Welcome to the 2017 Turning 65 Medicare and Social Security Basics Educational Seminar. This Medicare and Social Security Basics Educational Seminar is designed to help you better understand Medicare, the Part D prescription drug program, and the types of Medicare health plan options available to you, along with the very basics of Social Security. This seminar does not cover the specific Medicare health plans or their member benefits, nor does it cover the infinite details of Social Security eligibility. Medicare has not reviewed or approved of this presentation, nor has the Social Security Administration approved, endorsed, or authorized this presentation. Medicare does not review educational seminars. Thank you, and enjoy the Turning 65 Medicare and Social Security Basic Educational Seminar. The agenda for the Turning 65 Medicare and Social Security Basics Educational Seminar include these topics: a review of the basics of Social Security, a comprehensive overview of the Medicare program, what are your Medicare health plan options, comparing employer health coverage with a Medicare Advantage plan, a review of the Part D prescription drug benefit, Medicare Star Rating Program, when you can enroll in Medicare, and Part D coverage. Your information resources from Medicare, Social Security, and Medicaid. Hopefully, you'll come away from this educational seminar with a better understanding of the basics of Medicare and Social Security. In 1937, Ernest Ackerman was the first American to receive a Social Security lump sum payment. He paid 5 cents into the program and got 17 cents out. Ida Mae Fuller. Ida Mae Fuller lived to be 100 years old. In 3 years, she paid a total of $24.75 into the Social Security system. She was the first person to get issued a monthly check. Over her lifetime, she collected $23,000 in total Social Security benefits, about a 92,000% rate of return. Some basic terms you need to know. Full retirement age is referred to as FRA, which is the age a person may first become entitled to full or reduced retirement benefits. Primary insurance amount is referred to as PIA, which is the benefit received at a normal retirement age. The benefit is neither reduced for early retirement or increased for delayed retirement. SSA is short abbreviation for the Social Security Administration. For this seminar, we will only cover the basics of Social Security. Social Security is more complex today due to various personal factors which didn't exist years ago, such as when your parents retired. They probably just went down to the Social Security office as soon as they turned 65, or maybe 62 if they retired early, and applied for benefits. They took their benefits for granted and didn't ask very many questions. But baby boomers are approaching the Social Security question in a very different way. Education is key. Social Security is vital and one of the few retirement income sources that you can't outlive. Social Security also has an inflation protector. PIA and FRA are key terms. PIA is the primary insurance amount, and FRA, the full retirement age, will apply to individuals differently. Life expectancy is clearly important, ultimately the most vital fact, but also the one piece we have no control over. Married couples have options not available to single people. Taxes are also important and can be a real challenge. Medicare and Social Security do coordinate, and we will show you how. Understanding all of these items are important in order to get the most out of your Social Security. Among other things, here are a few more things to consider. Your current health, your family's longevity history, and, if you're married, the age difference between you and your spouse. One extremely important consideration that could directly influence you not collecting early is whether or not you're actually retiring. Are you collecting the benefit because you can? Or are you collecting the benefit because you're actually retiring and need the income? FRA, or full retirement age. FRA used to be age 65, and most people still believe it's age 65. FRA is gradually increasing to age 67, starting with people born in 1943 or later. In 2017, people born in 1951 will reach FRA at age 66. Anyone born after 1960, their FRA is age 67. Early filing can occur starting at age 62 up until your full retirement age. You can also delay filing up until age 70. Filing early or later than FRA will change your monthly benefit amount. Deciding what age to collect benefits as a single filer simply comes down to the question, how long do you think you'll live? However, by comparing payment cash flows, you're able to determine a break-even point that allows you to make a more informed decision. Whether you start receiving lower benefits early or waiting and collecting a higher benefit amount later, at some point you'll break even, which means you'll receive the same amount of money no matter when you started collecting. In the first example, the break-even analysis shows collecting at age 62 versus collecting at full retirement age. In this example, the break-even point is at age 78. In the second example, the break-even when taking at FRA versus age 70 is 82 and 6 months. If you think you will live beyond 82 and 6 months, you might want to opt to receive larger checks later and begin collection at age 70. While it's impossible to know exactly how long you'll live, you can make a reasonable guess about your current health and family history, and looking at your break-even age can help you when making your collection decision. Social Security takes into consideration your best 35 working years. It's important to double-check all numbers, as if there have been some mistakes. It could affect your benefit if not corrected within 3 years. You can also access your earnings record online at www.ssa.gov and create an account. Let's look at the numbers that have been magnified for us. This top number is your primary insurance amount and is your benefit if you were to collect at your full retirement age, or FRA. The middle number is if you were to wait until age 70 to collect, and the bottom number is if you were to collect at age 62. As you can see, there's almost a $900 per month difference between filing at age 62 and filing at age 70. How does filing earlier or later than FRA affect PIA? This example is for an individual with an FRA of age 66. In other words, they were born between 1943 and 1954. Filing as early as possible at age 62 results in a permanent 25% reduction of benefits. For example, if your PIA at FRA is $2,000, then filing at 62 reduces your monthly benefit to 75% of that, or $1,500. Benefit reduction decreases the closer you get to FRA. Delaying benefits increases your PIA 8% each year, up to age 70. So someone with an FRA of 66 can increase their monthly benefit by 32% just by delaying benefits as late as possible. Back to the example, someone with a PIA of $2,000 at FRA would see their delayed filing benefits increase to $2,640. It's best to discuss your Social Security options with a certified advisor. If you work and collect benefits prior to your full retirement age, your benefits are reduced by $1 for every $2 earned above $15,720 per year. The year and months leading up to your full retirement age, your benefits are reduced by $1 for every $3 earned above $41,880 per year. Once you reach your full retirement age, there is no earnings limit and no penalty. The spousal benefit for a non-working spouse with no PIA is 50% of the working spouse's benefit. For example, a working spouse PIA benefit is $2,200. The non-working spouse benefit is $1,100. Survivor benefit rules are as follows. You must be married for at least 9 months unless the death is due to an accident. The survivor must be age 60 for reduced benefits, or age 50 if disabled, or full retirement age for full benefits. There is no benefit if the widow or widower remarries before age 60, or age 50 if disabled, unless that marriage ends. A divorced spouse benefit is available if the marriage lasted at least 10 years. For example, both spouses are married and over full retirement age. Spouse A benefits are $2,000 per month, and Spouse A passes away. Spouse B benefits are $1,200 and notifies Social Security of Spouse A's death. The new Spouse B benefit is $2,000. Divorced spouses are entitled to get benefits of other ex-spouses if the marriage was at least 10 years, the divorced spouse is 62 or older and is unmarried, the benefit is less than his or her own PIA, and the divorce has been at least 2 years. Established in 1965, Medicare is a federal health insurance program and is designed for the aged and disabled. To qualify for Medicare, you must be a U.S. citizen or have a resident visa and be living in the United States for 5 consecutive years. You must be 65 or older or getting disability benefits for 24 consecutive months, or have kidney failure or end-stage renal disease, or approved Social Security disability with a diagnosis of ALS or Lou Gehrig's disease. When signing up for Medicare, you'll get a Medicare card that looks like the one on this slide. A couple of important points that you need to know about your Medicare card. Your Medicare claim number may or may not look like your Social Security number, or that of your spouse. If you're married and you didn't pay into Medicare for 40 working quarters, you could be covered by your spouse if they worked for 40 working quarters and paid into Medicare. Your Medicare claim number would be that of your spouse, with the letter B following the number. Be aware, there are a lot of variations of the Medicare claim number. If you have questions about your number, you can call Social Security or Medicare. It's important to understand that Medicare and Social Security are 2 different federal entitlement programs. At the age of 65, or earlier if you've been disabled for 24 consecutive months, you can elect Medicare as your primary health plan. As early as age 62, you can elect to sign up for Social Security. At what age you elect to start Medicare and Social Security is your option. Both can start at different times. If you have health insurance through your employer, you do not need to start Medicare until you're no longer covered, until you retire from your job, or your employer eliminates health insurance for its employees. You can start drawing Social Security incomes as early as age 62 and as late as age 70. Medicare is made up of Part A and Part B health benefits. Part B has a monthly premium you must pay when you start Medicare. Some options to consider. Number 1. If you start Medicare and you do not start Social Security, then you will have to pay your Social Security directly from your Part B premium. Number 2. If you start Medicare and start Social Security, then your Part B premium will be deducted from your Social Security check. Number 3. If you do not start Medicare and you start Social Security, then you do not pay a Part B premium until you start Medicare. Medicare gives letters to its types of health coverage. Part A is your hospital coverage, such as inpatient services and skilled nursing facilities. Part B is your medical coverage, such as doctor visits, lab work, outpatient services, and durable medical equipment. Part C is the Medicare Advantage health plans available to you. These Medicare health plans cover the Medicare benefits under Part A and Part B. Many of the Medicare Advantage plans also cover Part D prescription drug coverage. Part D is the prescription drug benefits available to you through private insurance companies, but regulated by Medicare. Medicare does not deliver Part D benefits. We will cover in detail Part A, Part B, Part C, and Part D, so you will have a thorough understanding of these components of Medicare. Original Medicare has exclusions and limitations you need to be aware of. No medical coverage outside the U.S. No coverage for routine vision, dental, hearing, and podiatry. No coverage for acupuncture, hearing aids, or dentures. No custodial care or nursing home care. Medicare has deductibles, coinsurance, and a Part B premium. Because Medicare does not cover all your health needs, there are financial risks associated with Medicare. If you elect to only have Original Medicare as your health insurance, you should purchase a Part D standalone prescription drug plan. The standalone prescription drug plan will have a cost associated with the plan. When you're eligible to enroll in Part D, there can be a penalty if you do not elect to purchase a Part D plan. This Part D penalty will be discussed later in the seminar. As indicated on the previous slide, Part A eligibility is for those aged 65 or older, or their spouse who paid Medicare payroll taxes for 40 working quarters. The 40 working quarters do not have to be consecutive quarters, just 40 quarters during your working years. Part A eligibility is available for those under age 65 if you've been disabled for 24 consecutive months. Individuals who had at least 30 quarters of coverage or were married to somebody with at least 30 quarters of coverage may buy into Part A at a monthly premium rate of $227. Those with less than 30 quarters of coverage, the monthly premium is $413. Because of income and assets, some individuals could have their Part A premium subsidized by a federal program named Qualified Medicare Beneficiary, or QMB. Part A Medicare benefits include hospital coverage for 90 days per benefit period, plus 60 lifetime reserve days of hospital coverage past day 90. Inpatient psychiatric care, up to 190 lifetime days. Skilled nursing facility coverage, up to 100 days per benefit period, only after 3 days of hospitalization. Home health care, not to be confused with custodial care. Home health care is medically prescribed home care by your doctor. For example, physical therapy in your home. Hospice care, which is end-of-life care. In 2017, Medicare has a Part A deductible of $1,316 per benefit period. That means when you check into the hospital, you're responsible for the first $1,316. After the deductible, for each day you're in the hospital per benefit period from days 1 through 60, the coinsurance is $0. For days 61 through 90, the coinsurance is $329 per day. And for days 91 through 150, the coinsurance is $658 per day. For example, if you're in the hospital for 90 days, you would be responsible for the first $1,316 deductible and 30 days of coinsurance at $329 per day. Remember, the first 60 days of the 90 days there is no coinsurance. You would then pay a total of $11,186. For a stay in a skilled nursing facility, there is no coinsurance for the first 20 days, but for days 21 through 100, the coinsurance is $164.50 per day. At age 65, if you elect to join Medicare and subscribe to Part B of your Medicare, your Part B premium is deducted from your Social Security check. If you've delayed taking your Social Security, then every quarter you will mail your Part B premium to Social Security. If you fail to make your Part B premium monthly payments, Medicare will drop you from Part B coverage. If you delay signing up for Part B coverage at age 65 because you're covered by other credible health insurance, such as your employer's health insurance plan, when you do elect to subscribe for Medicare Part B, you only have 63 days to sign up for Part B. If you do not sign up for Part B within the 63 days, you will have to wait for the Part B general enrollment period, which is January to March, with a July 1st effective date. Also, there's a 10% penalty for not signing up for Part B. For each 12-month period you delay enrollment in Medicare Part B, you will have to pay a 10% Part B premium penalty for as long as you're on Medicare. The Part B benefit covers the following services: physician services, outpatient hospital services, clinical labs, ambulance, diagnostic tests such as X-rays, MRIs, and CT scans, medical equipment, eyeglasses after cataract surgery. In 2017, there's a $183 annual deductible for Part B services, plus 20% of the Medicare-approved amount for services. Your Part B premium is based on your adjusted gross income from your previous 2-year return. For 2017, your Part B premium is based on your 2015 adjusted gross income. In 2017, the standard Part B premium amount will be $134, or higher depending on your income. Most people who get Social Security benefits will continue to pay a Part B premium of $109 each month. Increases or decreases in the adjusted gross income result in an increase or decrease in Part B premium for the current year. Part C refers to the Medicare Advantage health plans regulated by CMS. To enroll in a Medicare Advantage health plan, you must be enrolled in Part A and Part B and reside in the Medicare Advantage health plan's service area. Benefit coverage in a Medicare Advantage plan must be actuarially equivalent or better than coverage under Medicare Parts A and B. Medicare Advantage health plans may include benefits not covered by Medicare Parts A and B, such as dental, vision, gym, transportation, and acupuncture. Medicare Advantage health plans may include a Part D prescription drug plan. Medicare supplement plans are not covered under Part C and will be covered later in this seminar. When you enroll in Medicare, you have several options for your healthcare coverage. Number 1, you can remain on Medicare only and get your hospital and physician services anywhere in the United States where Medicare is accepted. You're responsible for Medicare out-of-pocket expenses such as hospital deductibles and copayments. Number 2, you can add a standalone Part D prescription drug plan to your Medicare. Number 3, you can maintain Medicare, add a Part D prescription drug plan, and subscribe to a Medicare supplement insurance plan, which covers up to 100% of your Medicare out-of-pocket Part A and Part B expenses. Since a Medicare supplement plan is an insurance plan, you may have to medically qualify for a Medicare supplement plan. Number 4, you can enroll in a Medicare Advantage plan, such as an HMO or PPO plan. These plans are basically network plans, which means you must stick with the providers in your network. Medicare Advantage plans cover Medicare Parts A and B and generally Part D prescription drugs, and can have extra benefits. Medicare Advantage plans can have a monthly premium, but many of them do not. There are many features for an HMO Medicare Advantage with Part D plan. They may have no monthly premium. Most plans have low or no copays for many services, such as hospital and physician office visits. There are no deductibles for Part B or Part D. Your network medical group coordinates care for inpatient and outpatient services. Except for certain screening services, such as a mammogram, in most cases, you need your primary care physician to refer you to a specialist. Medicare Advantage HMO plans may include health and wellness programs. Available through private insurance companies, Medicare supplement insurance covers the financial gaps in Medicare's deductibles, coinsurance, and copayments. The Medicare Supplement Insurance Benefit Chart details each lettered Medicare supplement plan and its respective coverage of Medicare's deductibles, coinsurance, and copayments. As you can see from the chart, none of the plans cover Part D prescription drugs. If you want drug coverage with the Medicare supplement plan, you must also purchase a standalone prescription drug plan. Plan F covers 100% of all Medicare deductibles, coinsurance, and copayments. At a lower monthly premium, Plan F with a high deductible is also available from some insurance companies. Plans M and N with coinsurance and copayments are generally price competitive with other plans. For plans K and L, there is a yearly maximum out-of-pocket maximum. Value-added benefits, such as wellness benefits, are not included on the chart, as each company has the latitude to provide these benefits on a plan basis. Before purchasing a Medicare supplement plan, check with the insurance company as to value-added benefits available to you. When you join Medicare, you have the option to select a Medicare supplement plan or a Medicare Advantage plan. Outlined are some of the key considerations in selecting the type of plan that's best for you. Number 1. A Medicare supplement plan has limited guarantee issue options, and availability may be based on your health history. A Medicare Advantage plan with prescription drug coverage, or MAPD, is guaranteed issue, except for end-stage renal disease. Number 2. With a Medicare supplement plan, you have direct access to specialists. While MAPD plans, you must select a primary care physician, get a referral for a specialist visit, and must stay within the designated provider network. Number 3. Medicare supplement plans have a monthly premium based on your age, plan selection, and your county of residence. Your monthly premium increases over time. MAPD plans have no or low premiums, which vary by county. Number 4. Medicare supplement plans have copays based on plan selection, while MAPD plans have no or low copays, but the MAPD plans could have a coinsurance for services such as radiation therapy. Number 5. For prescription drugs, with the Medicare supplement plans, you must purchase a standalone prescription drug plan. With MAPD plans, prescription drug coverage is included in the plan. Number 6. Generally, Medicare supplement plans have no or limited value-added services. You must purchase a dental and vision plan for coverage. For no or low premiums, MAPD plans do include value-added services, such as wellness, fitness, dental, and vision. Number 7. If you travel outside the U.S. for emergency coverage with the Medicare supplement plans, you must purchase a plan with foreign travel coverage. With MAPD plans, urgent and medical coverage is provided for foreign travel. Coverage limits vary by health plan. Special Needs Plans, or SNP health plans, are designed to aid a special segment of the population. Low-income Medicare and Medicaid beneficiaries, or duals. The clinically ill. Institutionalized beneficiaries. SNP health plans can include additional benefits, such as case management, enhanced prescription drug coverage, free diabetic supplies, transportation. According to the Kaiser Family Foundation, in 2015, employees paid $4,955 towards the cost of their health insurance. In 2016, that amount was well over $5,000. Medicare-eligible employees should consider the costs and health benefits of remaining on their employer's health insurance versus joining Medicare and subscribing to a Medicare Advantage plan. Employer health plans generally have employee contributions and costs associated with the health plan, such as deductibles to $10,000, physician copays, hospital coinsurance, and limited wellness benefits. Medicare Advantage plans have a Part B premium, but may have $0 copayment for physician, hospital, laboratory, and other services. These plans include wellness benefits, such as gym and transportation, dental and vision, and have emergency coverage outside of the United States. Part D prescription drugs is a key component of your health plan. Whether you add it to your Medicare only, to a Medicare supplement plan, or Part D is included in your Medicare Advantage plans. In the following sections, you will learn Part D enrollment periods, Part D penalty for not enrolling, Part D premiums. To be eligible for Part D, you must be enrolled in either Part A or Part B, or both Part A and B. Medicare does not administer Part D benefits. The Medicare health plans can offer Part D prescription benefits through their Medicare Advantage plan, which is termed Medicare Advantage Prescription Drugs, MAPD. Or the health plans can also offer, for purchase, standalone Part D prescription drug plans. Medicare members with both Medicare and Medicaid are auto-assigned to their Part D plan provider. You must select Part D coverage when you are first eligible for Part B, or you will pay a penalty when you do elect Part D coverage. The penalty is based on the national average of Part D premiums. For 2007, that is $35.63. All Part D plans must be minimally actuarially equivalent. In other words, they must all have the same basic benefits as required by the Centers of Medicare and Medicaid Services. The monthly premium can vary by Part D drug plans. Based on your adjusted gross income, you could pay an additional amount over the plan's monthly premium. For 2017, the annual deductible, if applicable by the drug plan provider, cannot be more than $400. The initial coverage limit or benefit for drugs is $3,700. The enrollee's out-of-pocket threshold for the gap or donut hole is $4,950. When you enter the gap, you pay 51% of the cost for generic drugs and 40% of the cost for brand drugs. The enrollee's cost share above the threshold, also termed catastrophic coverage, is $3.30 for generic or preferred multi-source drugs, $8.25 for all other drugs, or 5% of the drug cost, whichever is greater. Your Part D income-based premium is based on your 2015 yearly income, single or married. This is the amount you pay in addition to the health plan's monthly premium for your prescription drug coverage. For 2017, individuals with incomes of $85,000 or less, or married with incomes of $170,000 or less, their individual Part D adjusted premium is $0. You can see by the chart that the individual Part D premium adjustment rises with the increase in yearly income. An individual with $85,001 yearly income, or married in $170,001 yearly income, they would pay a monthly Part D premium of $13.30 in addition to the plan's premium. Each year, Medicare will evaluate your past tax returns and establish your Part D premiums for the current year. Increases or decreases in yearly income result in an increase or decrease in Part D premium. Medicare health and prescription drug plans get an overall rating that summarizes all categories of services and measures into a single star rating. The star rating of the plan's performance makes it easy for you to compare plans. If you're interested in more detail about a plan's star rating, you can look at the health or drug plan summary scores. A plan's star rating is reviewed each year and results are available each fall. A plan can get ratings between 1 and 5 stars, ranging from poor, 1 star, to excellent, 5 stars. You can switch to a plan that has an overall 5-star rating at any time during the year. You can only make a switch to a 5-star plan one time a year. Initial Coverage Election Period, or ICEP. Your initial enrollment into Medicare Part A and Part B is termed Initial Coverage Election Period, or ICEP. This ICEP begins 3 months before your 65th birthday, includes the month of your birthday, and extends 3 months after your 65th birthday. If you elect not to sign up for Medicare when you turn 65 because you have creditable health insurance coverage through your employer, union, or VA, then when you do sign up for Medicare, your timeline to complete your enrollment is different than your initial coverage election period. You have only 63 days to enroll into Medicare after losing your creditable coverage, or you will pay a 10% penalty of your Part B premium for every year you did not enroll into Medicare Part B. If you have creditable coverage through your employer group, union, or VA, Part B enrollment can be pended beyond your initial month of eligibility. Part D Initial Election Period, or IEP. For those who are newly eligible for Medicare's Part D prescription drug coverage, the initial election of Part D occurs simultaneously with ICEP. Only one Part D enrollment choice can be made, either a standalone prescription drug plan or one included by enrolling in an MAPD plan. Those eligible for Medicare prior to age 65 will have another ICEP when attaining age 65. The open enrollment period with a January 1st effective date begins October 15th and ends December 7th. During the open enrollment period, Medicare beneficiaries can stay or change their health plans to Medicare Only, Medicare Supplement Plan, Medicare Advantage Plan, Prescription Drug Plan. They can also return to Original Medicare. The annual disenrollment period is January 1st to February 14th, where Part C beneficiaries can disenroll from their MAPD plans and return to Original Medicare, and may enroll in a prescription drug plan and/or Medicare supplement plan if they qualify. A Special Enrollment Period, or SEP, is for Medicare beneficiaries experiencing unique qualifying events, such as involuntary loss of their employer health benefits, or moving to an area where your current Medicare health plan is no longer available. During SEP, you have one opportunity to change a Medicare Advantage plan or Part D plan. Those with dual eligibility for Medicare and Medicaid can enroll anytime during the year, as can those with Low Income Subsidy, or LIS. Medicare has excellent resources for information about Medicare. You can go to the Medicare website at www.medicare.gov or call Medicare at 1-800-MEDICARE. For help with Social Security, you can go online at www.ssa.gov or call Social Security at 1-800-772-1213. TTY users should call 1-800-325-0778. For questions about Medi-Cal, their website is www.medi-cal.ca.gov or call 1-800-541-5555.